And last but not least, our fourth group, which had the ambitious task of dealing with the whole big picture, the integrative approach. Louise, do you want to report out on your group's findings?
Sure. There should be some slides there. There we go. You'll see many of the same themes coming up in our discussion. We had a very lively discussion, and it was started off, Bobby Milstein asked around the table were the cases where people could tell about models that had worked or not worked. And we had two instances given that helped frame the rest of the discussion. George Isham talked about the model of breast cancer screening that was considered by the U.S. Preventive Services Task Force and said how illuminating it had been to him. But then, of course, when the task force made their recommendations based on that model, and he described the recommendations they made as very liberal in view of what the model showed about the efficacy of breast cancer screening, the public reaction was completely negative. They didn't buy any of it, and the whole thing was a big bust-up. Ray Michaels brought up the case of a different kind of model, and I think this is perhaps one of the interesting things that came out of our discussion. We pretty quickly started talking about more than mathematical models. He brought up a program model that was urged on a number of communities, and the Kellogg Foundation presented or funded various groups to undertake it. It required that you find 50 people or 50 households to begin this program. Every program that took that money except Ray's failed, and Ray's didn't fail because they said, after they tried it a bit, this isn't working, and went back to the Kellogg Foundation and said, okay, no thanks, we can't do this, because they discovered that it went against a number of community organizations and the community structure that was already there, and they needed to work with that, so they needed to adapt to what was already in the community. So we kind of took off on all of those and kept twining those various ideas. Early on, everybody has emphasized the need to get the community involved, to get the stakeholders involved early on. That seems to be first, before you even start any modeling. Who's represented? Ray said, if the community doesn't trust you, the model's not going to work. So you have to build that conversation first before you start presenting model results or model schematics or any of that. And the stakeholders, the community, everybody who's going to be involved in considering these results, making decisions based on these results, needs to come together, first of all, to define the problem. What is it we want to accomplish here? How do we want to accomplish it? It was said earlier this morning, certain interventions aren't going to go over in certain communities. So you might not want to bother to model those, or if you do, you want to understand that those are strictly there to kind of try to broaden people's perspectives, but they really want a subset of those interventions modeled. You have to identify the interventions that they're willing to consider implementing and include those in the model. So defining the problem, even before you start putting it in mathematical form, is a large part of what's going to make a model successful. We're bringing everybody in who's going to be involved in solving that problem. The next slide, please. With systems models, and our topic covered pretty much everything, inside or outside the healthcare sector, so we thought in terms of those. And another thing that this group of stakeholders needs to think about is how broadly do we want to draw the boundaries? You can draw the boundaries very broadly, you can draw them very narrowly, you can draw them so broadly that they're virtually impossible to model. But the real question is, what do the people involved want to see? What do they see as the factors that need to be taken into account? Every model is a simplification. What simplifications are they willing to live with? And what are the things they think absolutely must need to be in the model? One of the issues that came up in that respect was taking time into account in a different way from one of the earlier speakers, not so much taking time into account in terms of how long the model was going to project, but one of our participants brought up the case where a legislator presented with the information that we really shouldn't be doing X at all, we should be doing Y, said, okay, let's cut X. Well, in the real world, you don't cut X right away. You have to allow time until you've got Y up and running. So there are certain pragmatic issues that need to be taken into account that the model may not reflect. Another one of those simplifications, but that when people are using the model, you have to remind them here are some of the things you want to think about. These are the model results, yes, but now if you're going to apply these model results, think about how you're going to apply them, the fact that in the real world it's going to take time to get Y up and running, and so on. The next slide, please. So we did talk a lot about communication, and because of those two examples, which were so interestingly different from each other, we also talked about the mental models that the community already has in their own heads. They're not simply waiting there for modelers or decision makers who hire modelers to tell them what to think about this. They've already got ideas in their heads, and those are their models of what's going on. This could be one of the problems, for example, with the Breast Cancer Task Force's recommendation. The mental model that the public had was cancer is always deadly, it's always best to catch it early, and screening is nearly perfect. And in fact, that was a matter that wasn't so much even a matter of communicating the model results to the public, that was communicating the scientific evidence to the public before you even try to put it into a model. Which comes back to that notion that you really need to sit down and think with the stakeholders, what do we need to communicate here before the model results can become useful to people? Now that's kind of an idealized representation of how modeling would go. You'd get everybody together, they'd all agree this is how we want to model it, and so forth and so on. Sometimes the modeling process can serve a more disruptive purpose, and that may be the case of what's going on with the breast cancer screening, because George also mentioned the fact that people are starting to come around to what the U.S. Preventive Services Task Force did recommend. It's taken a while, but what got it started? Putting out those revolutionary results based on a model that had persuaded a number of scientifically astute people that that's what should be recommended. One thing that can be helpful in bringing people together, if you're coming back to the idealized process and not just tossing it out and then going around and around until everybody comes together, but if you want to start the process with a little more harmony in the beginning, would be perhaps to start with a conceptual model and some notion of the scientific evidence that's involved that you are then going to put together in the model and say, all right, is everybody, what do people need to know about this before we start putting the model itself together and looking at the implications of this information for the decisions we're going to be considering?